Hello, I'm Dr. Ron Thomson. I've got a background in general and traumatic surgery over many years, and I've been involved in doing orthopaedic type medico-legal assessments for some decades, totaling in excess of 40,000 to date. I've been working across all jurisdictions, being workers' compensation, third party and public liability, occupiers liability and TPD superannuation claims. And recently I've limited my practice to what's known as civil liability claims, being public liability, occupiers liability and TPD superannuation. The reason for limiting my practice, as I've said, is to move away from the heavy regularity burden of CIRA. There are differences between medico-legal assessments for civil liability claims and workers' compensation and third-party claims, which make activities in that section of considerable importance for civil liability claimants. The differences are somewhat subtle, but they're very important. And therefore, I think that the type of report that relates to civil liability claims differs in a material respect from workers' compensation and third-party claims. And the order of my reports commences, of course, with history, which is vital. But the next item relates to activities of daily living, which can be vastly adversely affected in public liability and occupiers liability claims. And I go into those aspects of the problems of the patient in considerable detail, whereas this type of attention isn't necessarily as prominent in workers' compensation or third-party claims. The next section of the report deals with treatment or management, which is generally the same throughout all of the jurisdictions. But the next part of the report, after the ones that I've mentioned, relates particularly to domiciliary assistance. This again is not always all that well covered in workers' compensation or third-party claims, but is very important with public liability and occupiers liability, as the disability of these people can be quite substantial and necessitate huge amounts of domiciliary assistance or domestic assistance. And I place a considerable degree of importance on those in my reports as well. And lastly, but not least, is the assessment of disability, where when asked to give an opinion on that, the framework used is the loss of efficient use of the part or parts, which I think gives a far greater capacity on my part to give an opinion on the real disability of these people and escape the shackles of the impairment system under AMA 5 or AMA 4, where I think considerable inequities exist and affect the injured people. I think this is a fair summary of the differences between these civil liability claims, to which I now restrict my practice, and the other types of claims from which I have moved away, and commend it to your attention and thoughts accordingly. Thank you for listening there, and goodbye for now.